Because injuries occur in nursing homes, people have questions about whose responsibility is it? And we all have our own responsibility to take care of ourselves. However, when we're in a nursing homes have responsibilities that arise from the fact that they gain income from Medicare, Medicaid, and other insurance companies when they take on the responsibility of caring for our loved ones. And it only stands to reason that when you profit from an activity, if you are negligent, if you do not follow the rules, if you do not meet the standard of care that you're required to meet, you ought to be responsible for fair compensation if you cause harm. And harm is caused in nursing homes from time to time because of understaffing, because of not pursuing the standard of care that's necessary given what you know about the patient. For instance, that the patient is a fall risk, and not putting in place necessary measures to minimize the harm that could result from an expected foreseeable fall. Nursing home residents often are incontinent and therefore their sheets get soiled. They can't care for themselves when they're laying in one position a long time. The soiled sheets and the inability to move around result in pressure ulcers on their backside or on their heels. Now, when those things happen, there are rules that every caregiver in a nursing home is well aware of, that if followed would minimize the harm caused by those kinds of foreseeable events. Nursing home stays can often result in very, very serious injuries due to falls, due to pressure ulcers, due to abuse by other patients or the staff. So because there are federal rules in place through Medicare and Medicaid and through the Ohio Administrative Code on a statewide basis that apply, there is a lot of documentation that exists every time someone is a resident of a nursing home. So when folks complain about the care that their loved ones are getting, there usually are records. And if the records can support that, well, then a claim can be pursued. But not every injury is an injury that should result in compensation, because the nursing homes, they're not insurers of everyone's health and well-being. They just have to follow the standard of care.